Let's return to an issue we've been focusing on a little bit over the last few days, and that is the plight of unplaced junior doctors. Yesterday we heard that over 280 interns were awaiting placement at a hospital. It's a yearly problem. It's related to funding shortfalls, and it seems the pandemic has not increased the urgency to solve the problem. The SA Medical Association Trade Union is now demanding action, and I'm joined by SAMATU spokesperson, Dr Cedrick Sihlangu. Doc, thank you so much for joining us. So it's such a frustrating situation. What exactly is your union demanding?
Thank you very much, Sally. Thank you for the platform. I think before we start, SAMATU just wants to take this opportunity to wish a happy National Doctors' Day for our colleagues in India. They really bravely fought through the peak of their third wave due to the Delta variant of the coronavirus. So we say they deserve all the honors. Now, to come back home, we are facing a crisis of our own. This is compounded with the current third wave of the COVID-19, which is doctors sitting at home without employment. It's laughable to think about it, that during a pandemic of this nature and a health crisis of this nature, you could have more than 300 now doctors that have reached out to SAMATU with an outcry to say they've been sitting at home, some of them since January, in fact, with the hope that they'll be placed in the media placement of the 1st of July. So these doctors should have started working effectively today, but up until now, they still haven't been placed. Now, of course, as you correctly mentioned, it's a yearly problem. Now, we as SAMATU have diagnosed this as a failure in government, because surely you can't have a situation that repeats itself day in, day out with nothing being done about it. And it's really a cause for concern, because you can change ministers, and that has been the case. You bring this one, you make this one acting, but the problem still persists. And it's unfortunate, really, that we are facing we're facing a situation now where we are having symptoms of a failing government, really.
What is your demand as SAMATU? What do you want to see happen, and what sort of deadline are you putting in place?
Okay. Well, on our media statement, we say we need all the doctors to be placed within 7 days. But maybe before that, just for the benefit of the viewers at home, is that the unfortunate situation here is that this internship and this community service, it's a statutory obligation, meaning that a doctor who duly goes to medical school, qualifies, graduates, unlike any other employee, cannot go and seek employment anywhere, like in the private sector. Here, it's mandatory for you to actually find employment in the public service, and you serve the government for 2 years of internship and 1 year of community service. Now you have a situation where a doctor has graduated, he's waiting to be placed for over 6 months, sitting at home, idling, doing nothing. Now, we are saying, surely, if government is facing such a crisis, and some say it's a monetary crisis, there's a problem with the purse, but we say, to the detriment of the doctors, it can't be. You can't have a fully graduated doctor sitting at home and doing nothing. So we say one of the options that we need to start entering that debate or discussion is to say maybe it's time we look at private-public partnership, where doctors can begin rotating in the private sector and rotating in the public sector. Obviously, with the understanding that perhaps private sector can also fund some of the posts, because currently you have to wait for a state post, and you can wait for 6 months to be on that, as we are seeing at this moment. So we are indeed calling for new ways of thinking about the solutions to this problem, because it can't be that every year we have to scramble around and look for posts when government is failing to provide such.
Yeah, absolutely. And that sounds like a really creative suggestion. What are you going to do if government hasn't placed, as you say, there's actually 300 intern junior doctors, if they haven't been placed by the 7th of July?
Look, that's a very difficult position to be placed in. You could imagine, as a union that advocates for doctors to be placed in employment. But look, one of the things that we've been doing, I mean, we've been reaching out to the ministry, the acting minister now, who's been newly appointed to act in the Department of Health. We've been engaging, and one of the strategies that we are utilizing is to galvanize other segments of society, including us being an affiliate of COSATU, to bring COSATU on board and to say, look, we have to strong arm our government to take some strong action, because this situation cannot persist.
Yeah, absolutely. 300 doctors who are desperately needed at this time. Well, thank you so much for chatting to us this evening. That is spokesperson Cedrick Sihlangu from SAMATU. That's the SA Medical Association Trade Union.